Welcome back to Dissect the Question. A physical trainer tells his client that calcium metabolism is important for building muscle strength because calcium ions provide the spark for muscle contractions. Which of the following best describes the role calcium ions play in muscle contractions? Well, A, B, C, D are all dealing with calcium, so we can't eliminate any from that. We don't really need the clinical vignette here. Which of the following best describes the role calcium ions play in muscle contractions is a standalone. We can answer it without the vignette, so it doesn't require much dissection. But let's do a quick job of looking at the best answer. So, since we're asking about calcium playing a role, it makes sense that it's going to be more calcium rather than less calcium. But we have to be careful because sometimes the wording on these kinds of questions could be tricky. Maybe there's something in the wording that's going to cause us to think less calcium is going to be a better answer. But I would first try to dissect the question based on more calcium, just based on the way it's written. Calcium playing a role in contraction seems like you're not lessening the calcium, you're increasing the calcium. So we have C, more calcium in the sarcoplasm, or D, more calcium in the sarcoplasmic reticulum. So it's kind of a play on words, isn't it, where we have to know the difference between sarcoplasm and sarcoplasmic reticulum. So if we look at a sarcomere, which is our contractile unit of the muscle, we have two Z lines, thin actin filaments attached to those Z lines for overlap with a thick myosin filament. So here's the actin, and there's the myosin. And we know the active tension for purposeful movement comes from cross-bridge cycling. When calcium enters through the T-tubules and binds with the troponin subunit of actin to create these cross bridges, then the Z lines come closer together, and we call that active tension, which is the force for purposeful movement. Good. So the calcium's coming from the sarcoplasmic reticulum to increase the cross-bridge cycling and muscle twitch and contractile force, not the sarcoplasm. Where is the sarcoplasm? It's a confusing term. We consider the sarcoplasm the cytoplasm, where we have the entire sarcomere. So the sarcoplasmic reticulum is associated with that Z line and the T-tubules. We'll put a T here for T-tubules. Out here, but in here, we would call this the sarcoplasm. Sarcoplasm. Cytoplasm or sarcoplasm. Not the sarcoplasmic reticulum. Sarcoplasmic reticulum are channels. Sarcoplasm is fluid. So I think we've picked the correct answer already. It seems to be D, which is a no-brainer. And I think we can eliminate less calcium causing slowing of cross-bridge cycling. It's not logical that calcium would slow cross-bridge cycling. Although, believe it or not, I'm sure there's some time when that happens, but not during normal excitation-contraction coupling.